Hello, this is Dr. Bob and Debbie DiMaria. Welcome once again to our half-off health program, and I have so much to talk to you about, and the key is this liver right here. Ladies and gentlemen, the liver is located right here in your body, right on this right side. The liver processes the estrogen. I've read, as I mentioned, 95% of all breast cancer could be directly related to too much estrogen. We live and we swim in a sea of estrogen. Estrogen is everywhere. It's even in canned food. All you have to do is look at the lining inside of the canned food. It's made of BPA, which is bisphenol A. If you notice that you have little red bumps on your body, they're called cherry hemangiomas. That's serious to me. If you have spider veins, varicose veins, or hemorrhoids, and or the cherry hemangiomas, or if you have bronzing on your left cheek, ladies, that's a body signal to me that more than likely you have liver stagnation. Your liver is being compromised. A couple other thoughts about this. You may have had your gallbladder out. You maybe have had 2 children and had your gallbladder out. That's important for me to know that, because I know that your liver is not functioning optimally. Your liver needs to process the estrogen. So what happens if your liver is not processing the estrogen? You're going to have tender breast and a heavy menstrual flow and maybe even a fibroid. Now pay attention to this. If you have a heavy menstrual flow, that's a body signal to me, too much estrogen. If you go to your conventional healthcare thinker and they want to cauterize the inside of your uterus, that's not wise. Now, what I would suggest you do is change your diet, eat Dr. Bob's ABCs, a half a red apple every day, a 1/3 cup of beets, 4 or 5 baby carrots, or a medium carrot every day. These 3 foods will help purify your liver. Of course, you want to minimize sugar and even ice cream products. Dr. Bob's ABCs is going to help your colon function better. It's going to help your liver function better also. And then you'll notice your varicose veins, your spider veins, and hemorrhoids will start to go away. Pretty wild, huh, Deb?
It is. Just by eating ABCs. Dr. Bob, would you eat organic?
Well, you know, it's very interesting, Deb, because over time, more and more stores today, even conventional stores, that means non-health food stores, have organics throughout the store. So we always encourage our patients to eat as much organic they can. Steam it, raw, baked, but don't do it the same way all the time. Always do a variety of foods. Sometimes raw, sometimes steamed, sometimes baked. You don't want to eat. You want to rotate your food. The huge question that we always have in our practice is about hormones. What's very fascinating, what I'm going to show you today is right now, years ago, hormone replacement therapy was common. Everybody had any issue at all, they put them on some type of hormone replacement. And the number one reason that a female would go to her healthcare provider was hot flashes, and they would put her on hormone replacement therapy. What Debbie is so kind to hold in her hand right now is a picture of a puzzle. Now, there are all the pieces in the puzzle right there, and everything looks like a nice little scene of dogs and cats, and everybody's having a lot of fun. Well, in the one that I'm holding here, if you'll notice where I'm holding my finger, we have these little black dots. I want you to think of this as synthetic female hormones. This is natural female hormones right here. Traditionally, they would get the components or the constituents to make synthetic hormones from pregnant mare urine. Now, that does not make a whole lot of sense to me, to put horse pee in your body, but literally that's what you're doing. And what happens is that the estrogen that happens to be in horse urine is too strong for the female, the human female, to handle, and it causes chaos in the body. So ladies, if you're continuing to have issues with hot flashes, what we found from our experience, one of the leading causes of hot flashes is potentially not enough iodine. And we have actually had some people, Deb, where the hot flashes went away by taking at least 1 tablespoon of flax oil every day with great success.
So we do treat a lot of people that are a lot of women with hot flashes.
Oh,
I mean, that's just like a common in
very
our
common.
office.
And you know what? We also see a lot of ladies that are in our office today, Deb, and men included, that have no desire for intimacy. And I'm telling you, everybody thinks that Americans have this ravenous sexual appetite. You know, we've been really privileged to write several books, and we also have a book on sex and romance. And the reason that we wrote the book about sex and romance was the fact that we have so many people that come into the office that have no desire to have intimacy. And if that is you right now, what's going on more than likely is your body is exhausted. What I'm holding in my hand is some copper tubing. Now, why am I holding this for? Because what I learned over time is that if you have high estrogen, you tend to have high copper. When you have high copper and you have a lot of estrogen, the bile that's flowing from your gallbladder and your liver becomes thick and stagnant, and you're not going to have proper nutrients inside of your body. What I also find with people who have high copper is they have a hard time falling asleep at night. Well, what causes the high copper oftentimes is you may in fact be eating too much wheat and soy. When you eat wheat and soy, it depletes the body of zinc. When you eat wheat and soy, it depletes the body of zinc. I said that twice because that was important. We don't promote soy. I don't think soy is a health food. I believe that soy, because they heat it to high temperatures, is actually detrimental to your body. And if you have a child anywhere from 0 years old to 20 years old, both male or female, soy does not do the body good. I would much rather have you try maybe some pumpkin powder protein as an alternative to soy protein. There's a lot of controversy about soy. We don't promote genetically modified. And as a side note, look at your vegetables, and if you see the label on the vegetable and it has an 8 in front of the series of numbers, that's a signal that that's genetically modified. Organic food is usually labeled and starts with a number 9. Genetically modified is an 8, organic is 9. All the other numbers are what they call standard foods. But I would be amiss if I did not share with you what we do in our office every day. This is a spine. Your brain sits in the skull, continues on as the spinal cord. Vertebrae can go out of alignment, and when they do go out of alignment, we call that a subluxation. A subluxation is when your body's not able to communicate because the information is shut off. And what Debbie's so kindly holding is that there's this loop here that continues on. 28 billion messages are sent from your brain every day telling the body what to do. So if you're having chronic spinal dysfunction, or you've been to every doctor, I've had patients been to 8 to 10 doctors before they finally show up at our doorstep, we'll do a spinal assessment. But the reason I'm bringing that up to you right now, because we talk about this in the book, you may have alternating monthly headaches. That means one month you have a headache, the next month you do not. Well, it's very possible that you could have subluxation or misalignment to the vertebra right here that sends messages to your ovaries. And if your ovaries are not functioning properly, they cannot make progesterone, and progesterone balances estrogen. See, estrogen causes cell proliferation, and progesterone balances it out. And what we have found from our experience, and this is so critically important, is I'm going to talk about iodine one more time briefly here. Most of you that are watching me right now don't have enough iodine in your body. Iodine is important for the thyroid, breast, and ovaries in a female, and testicles in a man. If you have cysts on your ovaries, this is so critically also important, and I know that I'm just beating this down, and you got to get this. If you have polycystic ovarian syndrome, PCOS, go ahead and do a search on that. We have found in our experience it could be due to a lack of iodine. Do you experience cold hands and cold feet? Lack of iodine. Gentlemen, pay attention to this. What we have learned over time that a man can have prostate challenges because of not enough iodine. Bromine, fluorine, and chlorine antagonize iodine in a person's body.
Well, you know what, Dr. Bob? It is also for nail health. Iodine is very important for your nails, and we have noticed that what has happened in our society is there's nail clinics all over the place. So most women hide the shape and health of their nails by putting false nails on, and the reason is they are probably lacking iodine.
You know, Debbie, it's so interesting because you bring such a phenomenal point. Is the sunglass industry is ginormous. Well, that's a body signal for weak adrenal glands. Now, we briefly talked about the adrenal glands earlier. They're your backup gland. Ladies, if you've had mental discomfort and challenges your whole life, and all of a sudden you're coming into what we call menopause, and you're having major disturbances in your body, chances are your adrenal glands are not making enough natural progesterone and natural estrogen. So you do need to have estrogen. I'm not telling you to stay away from estrogen, but the issue is we live in a sea of estrogen today. Watch the water you're drinking. You want to drink water from a pure source. If you are consuming tap water, chances are it could have too much estrogen in it. So what you're putting in your side of your body is very important. I would encourage you to eat more organic food instead of conventional food, because organic food is typically chemical free and allow your body to function properly. Okay, now in the hormone aspect of what's going on, the pancreas is a very important organ and gland. The pancreas makes enzymes, and what we have learned over time, if you consume a lot of processed foods, your pancreas is going to wear out and it's going to impact negatively digestion inside of your body. So you want to make sure that you're eating, I would eat some slices of cucumbers or even baby tomatoes with your meals to get the enzymes that your body needs for you to function at full strength. Let's talk briefly about osteoporosis. Osteoporosis is quite common today, and I usually see osteoporosis in women who may not exercise. They tend to drink a little bit more soda than they should. I want you to think of your bones as coral. Coral that faces the ocean or coral that faces the bay. The coral that's inside of the bay is usually very dull, but the coral that faces the ocean is very bright and vibrant. So you want to be doing some weightlifting, ladies. You want to be using a band. You want some type of resistance. I would avoid sugar as much as you possibly could, because sugar robs the body of nutrients. So osteoporosis can be helped. You don't necessarily have to take that osteoporosis medication. You want to have an assessment, maybe your thyroid profile checked, maybe mineral tissue analysis. And finally, as we wrap this up, we have the ability today to test for the essential fatty acids. See, your body works by fat, and we have the ability with a blood spot test that we send to a lab that will tell me exactly what oils you may have too much of or too little of inside of your body. And we could actually create a strategy to help prevent disaster. We have found oftentimes that most people who have emotional challenges are low in a type of fat called DHA. That's delta hairy apple. If your DHA is low, you have a little bit more chance to have some emotional challenges and behavioral issues and maybe even forgetfulness. But what is a major issue is dairy products. Dairy products can cause pain. We don't encourage dairy products per se in our practice, and if you do decide you're going to use dairy, I would always use organic dairy products. Something else that I've just learned over time, especially for the ladies that have chronic neck and shoulder blade pain when it comes to even to hormones in the body, there's a better source of calcium than yogurt. I would encourage almonds, sesame seeds, walnuts, and of course, any type of green. Bananas can cause your left neck to hurt. I know so many of you are concerned about having enough potassium. Cucumbers and avocados are a great source of potassium so your body can function optimally. So right now you have a question. Okay, Dr. Bob, I'm tired, I'm sluggish, I have no desire to have intimacy, I have hot flashes every day, and I haven't gone to the bathroom in 3 days. What should I do? Start drinking water. Start focusing on more vegetables. The only fruit that I really promote are pears, plums, and apples. And of course, I want you to eat that half an apple every day. You should give our office a call today to have a subluxation assessment. In other words, we need to look at your alignment. You may in fact be someone that we might need to do some saliva testing to find out exactly what's going on inside of your body. And finally, I'm going to encourage you. This is the second edition of Dr. Bob's Drugless Guide to Balancing Female Hormones. Get this book. Come to our office. We can mail it to you. You can go to Amazon. You can ask at any major bookstore throughout the United States. This book will change your life. I guarantee it. We talk about everything I just talked about on the program today. We go into great detail. There is even a special chapter in here on weight loss. Gentlemen, we have a special chapter in there for you too on testosterone. There is something called andropause, which is just the counterpart to female menopause. You don't have to live in misery every day. You don't have to live with a lot of pain. You can live a drug-free, happy, long life, but to get what you've never done before, you've got to do what you've never done before. The reason you are the way you are right now is from your past choices. Call my office today. You'll be glad you did.